Excellencies, distinguished colleagues, ladies and gentlemen, I would like to thank the Italian government and especially the Ministry of Health for choosing women's health as one of the priority areas during the European Union presidency of Italy and for organizing this very important ministerial conference. I also would like to thank representatives of the Ministry of Health of Italy who are in constant contact with the WHO Regional Office for Europe, promoting collaboration and pushing forward the public health agenda in Italy, in the European region, and globally. I would like to express my gratitude to the participants of this conference for their work so far in improving women's health in the countries of the European Union. The Ministerial Conference Women's Health, a life course approach, takes place at a time when all countries have finalized the assessment of the achievements of the Programme of Action of the International Conference on Population and Development, held in Cairo in 1994, and are now focusing on Beijing Plus 20 achievements of the Millennium Development Goals and on the post-2015 agenda. Women's average life expectancy in the European Union exceeds men's by almost 6 years. However, women face more years in poor health. What can be done to improve the situation? But there are big inequities in the status of health and well-being among the 250 million girls and women living in the EU, often starting from the early years of life and with a lifelong impact. There is almost a 10 years difference in the life expectancy at birth for women within the EU. Why do women in my country, Hungary, live 7 years less than women in Spain, France, or Switzerland? The probability of a newborn girl dying before the age of 5 differs more than 5 times between the EU countries. What can be done to prevent those deaths? There is remarkable progress in improving prevention of maternal death and promoting family planning in Europe. However, even in our region, thousands of women still do not have access to quality information, health services, and adequate medical supplies. WHO Europe, in close collaboration with partners, is assisting countries to decrease the unmet needs for information, health promotion, and access to health services, especially for vulnerable groups such as poor and rural population, adolescents, migrants, and ethnic minorities. A European policy framework, Health 2020, approved by all WHO member states of the European region in 2012, tries to answer some of the above questions and to suggest concrete actions. Health 2020 proposes new forms of governance for health, in which health and well-being are seen as the responsibility of the whole of society and of the whole of government, and encourages active public participation. I would like to welcome all civil society organizations participating in this conference, and I am convinced that their voices will be heard when women's health issues are discussed and ways forward agreed upon. I firmly believe that together we will find ways to reduce existing health inequalities and improve health for all. I would like to assure you that WHO will continue to support countries in improving participatory governance for health, revising their policies, and investing in health through a life course approach, and empowering people. Every woman, young and old, has the right to health and well-being, and we are to help individuals, families, and society to reach the highest attainable standard of health. I wish you all a very fruitful discussion, and also very pleasant stay in beautiful Rome.